It is one thing to live, but another thing altogether to suffer from lifestyle diseases. What are these lifestyle diseases and how do we understand them? And what are the solutions when we have any kind of disease that's related to our lifestyle? To speak about all that, I have with me today a very well-known specialist in internal medicine and kidney diseases, Dr. Sudarshan Ballal. Warm welcome to the show, Doctor.
Thank you, Deepak. Thank you for inviting me.
So what is this thing about lifestyle diseases that we need to understand?
You could not have brought this up at a more appropriate time. It has become a pandemic now. Lifestyle diseases, or what we call as non-communicable diseases, have become an epidemic and a pandemic not only in our country but all across the globe. The unfortunate thing in our country is that we have now this huge burden of lifestyle diseases in addition to the burden of communicable diseases like malaria, TB, chikungunya, dengue, gastroenteritis, so on and so forth. So our resources are really stretched. Now coming back to lifestyle diseases, now lifestyle diseases are diseases that come on because of the lifestyle you lead. The most common of them is diabetes, hypertension, kidney disease, heart disease, strokes or vascular disease involving the brain, peripheral vascular disease, and of course cancer. Now many of them can actually be rooted to your lifestyle, like being obese, inactive, and of course smoking. And I always tell people there are 5 S's that will kill you. That is salt, sugar, smoking, stress, and a sedentary lifestyle. And you can trace almost every lifestyle disease to these 5 S's.
But when you're talking about the 5 S's, most importantly what we need to keep in mind is that in some cases they're just the excess of those things, but in case of smoking, like you always said, you need to completely forego the habit.
Yeah, I don't think there's anything like moderate smoking or little smoking. Any smoking is bad, and I've told this to the audience before. If you want to ask someone to smoke, you might as well give them some cyanide rather than give them the smoke and kill them slowly. You might want to kill them with a capsule of cyanide rather than have a slow death in smoking.
But this is one thing many people don't understand. It's because when you're young and you start smoking, you don't actually feel any effects of it. And that's the reason that you stick on to it. You keep going with it. And you also get your friends to get into it because you don't immediately see any kind of changes happening within you. And anything happens is only when you're too old to do anything about it and too old to even quit it.
That's unfortunately true. Now what has happened is that very young people in their school and colleges are getting enticed to smoke because they see that as a macho image. Being a man is, of course now I can't say being a man because a lot of women smoke too. And then they think that it doesn't hurt them because they don't see the effects for quite some time. But once the effect starts, it's very difficult to stop it.
Okay, but how is it possible for somebody to understand that, the things that you do today, you'll have to pay for tomorrow? And most people want the pleasures of the moment because that is why many people feel that they are living. And even if they get an opportunity to enjoy life by the way they define it, they feel extremely happy about it. Whether it is sugar or salt or smoking or even a sedentary lifestyle to stress, because if you have all this sufficiently, it only shows that you're successful enough.
No, not really. I think with education, we have to create awareness and education among the general public. And I think the government, in all fairness, is doing a lot of that. If you see those horrendous pictures on the cigarette packs, I think anyone with any brains would shudder at the thought of lighting a cigarette because they have people with oral cancer, lung cancer, all kinds of things being shown on those pictures of the packs. And there's a very strong warning that smoking is terribly injurious to health. So, but I think we have to keep up the message that smoking is bad. And in my opinion, I think instead of banning drugs alone, we should add smoking to the list of drugs that have been banned in this world.
Okay, once again to talk about these things, Doctor, most people have a feeling that all these things won't happen to us. They happen to someone else. So we are safe, and they also give excuses like, my father did it, somebody else did it, look, my mother eats so much salt, somebody else takes so much stress, why would it happen to me? But there is no model example of why it would happen to somebody or not. It could happen to anybody, right?
Absolutely. I can give you a standing example of one of my patient families. The father is 98, hale and hearty, still walks to my office. 5 of the children have diabetes and 3 of them are on dialysis and 2 of them have been transplanted. So it doesn't mean that just because your father didn't have the disease, you won't get it. And it doesn't mean that some smokers who didn't get the disease are reflected in others who will not get the disease. I think there is a very good chance that if you smoke or if you indulge in...
They are not the glowing examples that you should emulate.
I think I would request or invite any one of these non-believers to come to the hospital, and on any given day I can show them every disease that's associated with salt, sugar, smoking, stress and sedentary life habits.
You seem to be quite abhorred by the whole idea of smoking. What kind of a reason has actually inspired this kind of a reaction to smoking?
I've seen the devastation associated with smoking. I mean, and as kids we all thought that smoking was a great thing to do. I mean, you felt like a man and you felt that you were doing something very different, heroic. But I think it's terrible, because I've seen the effects of smoking over the last 30 years of my practice in medicine. I have seen every known complication to mankind that has happened with smokers, and it's totally preventable. And the worst thing about smoking is not only do you harm yourself, you harm your neighbors, your compatriots, your country and your environment.
You are a kidney specialist too, but how does smoking affect the kidney?
The smoking affects the kidneys both by indirect means and to some extent from direct means. What we know is that smoking is terribly, terribly bad for all your blood vessels. So your blood vessels get narrowed, you have conditions like atherosclerosis, it leads to heart attacks, it leads to narrowing of the blood vessels elsewhere. People get into amputation, strokes, kidney disease, heart disease, and of course cancers of all kinds.
Now talking about the other things that people get a little addicted to, perhaps not so much addicted, but at least the taste of it in such an addictive way, like it could be salt or sugar, or even living a stressless life. And also a stressful life. Stressless life could be in terms of not doing any exercise, not going anywhere, and just sitting and watching TV all the time. And also stressful life where you actually take all kinds of stress possible and you suffer because of it.
I would like to make a little correction as far as the stress is concerned. Stress, I always tell my patients, stress in itself may not be bad, but if the stress causes you distress, then that's definitely bad. You have to have certain levels of stress, otherwise you won't be motivated. You will not want to do anything in life because you want to take it easy. Without a little bit of stress, you probably won't be motivated. But at any time the stress becomes distress, it's going to harm you.
Even if you don't have any stress at all, and if you're taking things very easy, even then it is dangerous, right? That if you don't want to do anything, if you don't want to play a game, if you don't want to go out, if you don't want to go for a walk, not play, you could live such a sedentary life. That's what you're talking about. Or do you actually talk about people do all kinds of things but don't exercise only?
No, I'm talking about sedentary lifestyle is people who don't exercise. Not that they
But some
don't
people, doctor, I mean, sorry to interrupt, but some people exercise, but otherwise they are extremely living an immovable life. So immobile life.
Yeah, I mean, I was talking to the physical inertia rather than the mental inertia. Physical inertia definitely is not good for you. Sedentary lifestyles cause you to put on a lot of weight. Most of it is fat, and we know that it's a lot better to have muscle rather than have fat with the same weight, because muscles are much more energy efficient than fat. And of course we all know that the consequence of obesity leads to a wide variety of diseases, again part of the lifestyle diseases complex. So I think whatever you do, try to do some exercise.
That you can exercise for about half an hour to 1 hour, and that is sufficient. Is that a wrong idea?
No, I don't think that is wrong. I mean, even though there may be differences in the optimal amount of exercise, a half an hour to 1 hour exercise on a daily basis, or at least 3 times a week, is far better than no exercise at all. So it is, if someone says that I don't get time, we tell him exercise as much as time that you get. Even if it's 20-30 minutes a day that you walk on the treadmill, walk in the park, or do whatever. Do that rather than just saying that I do not have enough time to exercise for 2 hours, or I don't want to exercise at all. Any exercise is better than no exercise. Any smoking is terrible.
But another thing, doctor, some people say that I walked about enough in my house. I've cooked enough. I've walked up and down the stairs. Isn't that exercise enough?
Well, if they have really done that, that's fine. The unfortunate thing is that we are not able to quantify what we do in a very scientific way. For instance, there's a good study, I'm told, where they interviewed a large number of people, people like us, and all of us felt we were very busy, and many of us would have told the interviewer that we work 14 hours a day, and then they actually had a scientific analysis of how much time you actually worked. It was less than 7 to 8 hours. So what we think that we have exercised in cooking, walking around the house, is a little difficult to quantify. So you might have exaggerated the amount of work that you thought you did, whereas if you say walk 45 minutes continuously, or if you say walk half an hour continuously, then you know you have put in that kind of work. But the bottom line is, any kind of exercise, whether it's routine housework, walking in the garden, walking in the park, treadmill, swimming, whatever you do is exercise.
You've been a big votary of walking, because you say walking not only does good for your body, but it does good for your mind also, and gives you a sense of well-being because of the release of pheromones.
Yeah, I am convinced that exercise makes you feel brighter. And I've seen personally, on some days you're so busy, you're really stressed out, because sometimes you see a lot of very sick people, and it does affect you when you have a lot of sick people to take care of. And you come home, you're practically getting ready to just get into the bed and zonk out. And the minute you go on the treadmill for half an hour, you're a new man. You're ready for another day's work, actually.
Has research actually explained this in some way?
Yeah, there are a lot of substances released from the body, including endorphins, which give you a sense of well-being after exercise. And there's no question that I think exercise does make you feel better. And anyone who's tired, if they exercise, they'll be good again to do some more work after that.
Okay, but we always keep talking only about smoking, but what about drinking?
See, now unfortunately with drinking, I mean, I am a proponent that drinking we would not recommend to anyone as a doctor, but there is no hard evidence to say that small amounts of alcohol once in a way is harmful to you. In fact, some people or proponents of drinking say there's some benefit of drinking, but we know that once you cross the limit, alcohol is bad. I mean, you can damage your liver, you can have so many other things.
No, it could also affect your sleep also to an extent. It could alter your behavior, most importantly, and destroy your community life.
I think sometimes what happens is anything that's addicting like alcohol, it's very difficult for people to control the amount. You might cross the limit very easily without knowing it, and once you cross the limit, then it's pretty dangerous. And a lot of people also don't realize that alcohol basically is sugar. So if you have propensity to gain weight or become a diabetic, it's like gulping a few spoons of sugar each time you have a peg of whiskey.
Doctor, another thing, I mean, most importantly when people speak about lifestyle diseases, they are talking about either the food intake or they're talking about exercise and other things. But there is another thing that some people have been talking about, but I think it's extremely important too, about sleep. Sleeplessness and what it actually causes to your body. Because perhaps, staying awake too late in the night or sleeping very little and all that.
I'm a strong believer in two things. One is I think everyone needs their beauty sleep. And how much that beauty sleep is can vary from people to people, but in general about 6 to 7 hours of uninterrupted good sleep at night is very good. I also believe that a short siesta in the afternoon does help. And I sort of do remember somewhere in Japan, I believe this was an experiment where after their work in the morning, they were given a spoon in their hand and then asked to sort of relax in a sofa. And the minute you fall asleep, your muscles become relaxed and the spoon would fall down and you'd wake up. So that much of sort of few winks that you catch in the afternoon apparently made them more productive. I strongly believe, and in fact I think this is now believed by a lot of people, a short nap in the afternoon, maybe 10 minutes, 15 minutes, makes you more productive. And people used to think these guys are lazy because they want to sleep in the afternoon. I mean, sleeping for 2 hours definitely is being lazy. But I think a short nap in the afternoon, I think it's good. But unfortunately, a lot of us work in a situation where it's impossible to do that. But I think a good night's sleep is very essential.
But when we're talking about food, we are talking basically about sugar, salt, and perhaps intake in terms of alcohol or other things. But are there some other kinds of food too which are affecting our body in terms of it deteriorating?
Well, there are a lot of, I don't want anyone of our viewers to go with the impression that everything that's connected with food is bad for you. There are a lot of things that are good for you. Anything that's rich in fiber, anything that has a lot of potassium in it, a lot of fiber in it, all these things are very good. And certainly I think we require certain proteins in the body to keep you going, and a certain amount of carbohydrates to keep your energy levels. So it's not that everything is bad. I think everything has to have a limit. The problem is when you cross the limit with whatever it is. I'm not saying that you completely stop sugar, completely stop salt. That may not be good for you. But whatever you do, do it in moderation, except if you have a disease where you have to restrict a certain style, a certain amount of food.
Any kind of toxic substances you consume, I mean, there are two organs that you are actually worried about. One is your liver and the other are your kidneys. But I mean, can you be 100% assured that, I mean, if the two organs that we're talking about are completely well and functioning, that you can actually abuse your body to some extent at least?
No, I would never take that liberty. In fact, I don't want anyone to go with the impression that just because my kidney and liver is okay, that I can get away with any kind of dietary indiscretion, or for that matter, indiscretion about taking anything that's toxic. One of the saddest stories that I would like to narrate quickly, if there's a time, is that we have an obsession with weight loss. And there is this famous person in Singapore where the girl gained a lot of weight and wanted to lose weight, and she took some Chinese weight losing pills, unfortunately very toxic to the liver, and her liver failed, and her boyfriend generously came forward to donate the liver, and he donated the liver, and she lived, and he died of the complications of liver donation. So you have to be very careful with what you take for whatever reason it is. In general, I think you should try the natural way of correcting things rather than take extraordinary measures.
What is your general advice to the youth, most importantly, about the kind of problems they may face because of any kind of deficiency in their lifestyle or excess in their lifestyle, and what they could do and what they could look forward to?
What I see in the youth of today is they're very smart, very intelligent, very bright youngsters, and very focused in some ways. But I think there are certain things that I think they need counseling on. I see a lot of them smoking, binge drinking. I was quite shocked that a lot of them are into binge drinking, and I think to some extent the TV and movies sort of propagate that. You see a famous starlet sort of gulping vodka, bottoms up many times in a row, and the same thing is repeated by some youngsters in the pubs and bars. Smoking definitely is a no-no, and I think there's a lot of addiction of junk food, and maybe a significant amount of them also abuse substance. There's substance abuse, which I think we should come down heavily on.
But finally, why is there no awareness about the body in general, in spite of people knowing about a lot of things otherwise?
So in this age of internet, I think there's no excuse for someone not knowing what's happening in the world. I think they can access any information that they want in the world. It's just that they may not want to access information that they don't want to know, or sort of ignore the information that they think is not necessary for them.
For instance, about smoking itself. I mean, they would rather know about somebody's lifestyle, they would know about somebody's children, somebody's money, somebody's hobbies, everything. But what happens to your own body with your own behavior is something people may not be so much interested in knowing.
I think there's a lot of hormones in the youngsters that they don't look at tomorrow. They only look at today. If only you looked at the mirror and say, what will I be tomorrow? I think many of these things would fall into place.
What is one advice that you would like to give to the viewers of this show?
One is, please follow the advice of controlling the 5 S's that can destroy you.
Sugar, salt, smoking.
Salt, sugar, smoking, stress, and sedentary lifestyle.
Yeah.
And I'm sure all of you will do very well. And I think I have a message for the government and for the people who are in public health. I think as much as we talk about preventing lifestyle diseases, I think it's very important that we also prevent diseases that can kill by infections. That is safe water supply, general hygienic measures, pest control, because many of the diseases we see are viral diseases that are spread by mosquitoes and other pests. So I think good clean drinking water, then public health measures, general hygienic measures, pest control, educational programs, and vaccination could probably save a lot more lives than the numerous heart surgeries, kidney transplants, and brain surgeries we do.
It was my pleasure speaking to you, Doctor, and it is quite educative for the people who use this portal, masterinhealth.com, and thank you very much for participating in this.
Thank you for inviting me. It was a great pleasure too.
Thank you.